Tonight we look at a puzzling and not altogether understood depression that occurs between the months of September to April. Technically, it's referred to as seasonal affective disorder, or SAD, but may be better known as the winter blues. We are choosing to focus on SAD at this time of the year because this is the time sufferers are beginning to experience relief from the emotional changes that have been affecting them. It's our hope that if you recognize yourself in today's discussion, you will consult with a professional over the next few months and devise a plan to prevent next winter's blues. To help us get a clearer picture of seasonal affective disorder, we have Dr. Edward Rochar, a Bay Area psychology returning favorite. Ed, I want to thank you for
good to see you,
coming back and being willing to talk about seasonal affective disorder. And I mentioned at the beginning why now instead of talking about it in the fall, because I think one of the harder differentials with this particular diagnosis is trying to separate out what's seasonal affective disorder and what's kind of traditional clinical depression.
Right. I think there's a couple of points there. One is that one of the things that I see in doing therapy is if you can prepare, you're a lot better off than trying to catch something in the midst of it. If you know what's coming up, if you can plan for it, then you can do a lot more to avert it or to minimize it than if you just, in the middle of a depression, try to fix it. So it's so that's a lot better. Two, you were pointing out that it's if you want to distinguish between the seasonal affective and other depressions or depression-like syndromes, then this is a real good time to do that because you have the whole summer and to reflect, to look at how your mood patterns change over the summer, see if you don't really go upswing during the summer, and if you have that nice clear pattern, then you probably are looking at the seasonal affective disorder, and when it comes to the time of year when it starts kicking in again, you're fairly clear about what the diagnosis is, and you're not scrambling to go, well, is this depression, or how should I treat it, what's going on? And so, yeah, that makes a lot of difference in being able to really diagnose and develop a good treatment plan.
Well, and you know, I think the important key here, too, is a recurrent pattern. I mean, you would know more about diagnosis than I, but my sense would be, in the research I did, that we're talking about something that there is a pretty clear pattern that probably goes back quite a number of years. So just because I had a very difficult winter last winter doesn't necessarily mean I have seasonal affective disorder. I mean, we'd really have to be looking at a number of years.
You know, and of course, this is kind of like a first onset major depression. What are you, at what point do you decide that, yes, this is really what you're looking at? So the first time you may not know, 3 or 4 years down the road, you go, oops, this has happened one more time, then yeah, you can identify it as the pattern, but early in the cycle of the pattern, you may not be able to see it clearly. And even as the cycle goes on, it may take some real careful attention to figure out when it is that these things happen. You may not be clearly associating, you may not think, well, I should be depressed because of things that are happening in my life, like, you know, divorces or deaths or things of this sort, and you may associate your down times with stressors at work or other things and not get clearly the picture that these things are happening seasonally, because what you're looking at are not stressors, not individual things, and we're much better at looking at events and saying, oh, that's it, than looking at a whole season here and saying, oh, it's, you know, it's this phase that I'm in. Well,
and particularly since it starts usually in the 20s and 30s, so this may not be something that you have. I mean, you can see it in childhood, but when I was doing the research, it seemed like a predominant number of people really, maybe it's just that they began to notice the pattern in their 20s and 30s, and it might have gone back before then. So, and in fact, some people don't even really recognize the pattern until they do have some sort of a triggering event that causes them to start evaluating this at all. But let's take a look at the actual symptoms. Let's see what we're actually talking about. Okay? Seasonal changes of mood or behavior in September through April, resulting in sleep problems, oversleeping but not refreshed, cannot get out of bed, needing a nap in the afternoon, maybe overeating, carbohydrate craving, leading to overweight, depression, despair, misery, guilt, anxiety, normal tasks become frustratingly difficult, and hopeless. We'll start with those. In terms of oversleeping, I know some of the literature referred to this as almost like hibernating, like bears.
Right.
Yeah.
Yeah, so you have this, the sleep pattern goes to the hypersomnia rather than the insomnia. And this is distinguishable from a typical or classical major depression in that you would expect, instead of a lot of sleeping, having early morning awakening for a major depression. And you tend to wake up early at, maybe depending on when you go to bed, but 3, 4, or 5, and you can't go back to sleep. That's very, very different than the hypersomnia that you would expect in seasonal affective disorder.
Okay, so really it sounds like no matter how much sleep I get, it wouldn't be enough. I would just kind of chronically feel fatigued.
Yeah, it seems like there's that fatigue in there, along with just the hypersomnia, the extended sleeping periods. Yes.
Okay, so and then in terms of carbohydrate craving, I mean, apparently, when I was reading about this, it sounds like there may be something going on that triggers a desire to self-soothe, or, I mean, or is there some sort of chemical process, do you suspect, that might...
Yeah, it's very possible that something like the carbohydrates increase serotonin, and it may well, in a somewhat natural way, reproduce some of the effects of the antidepressants, the selective serotonin reuptake inhibitors. So it's very possible that when you're doing that, there is the kind of psychological self-soothing that you get from the literal physical feeling of being full and comforted, and that whole part. But there's also not just feeling full, but also the biochemical part where some of the foods actually, some people suggest chocolate as well as being one of those that has a chemical effect on you and produces some mood elevating type feeling for the person who's going through this. So it could be acting on them in a couple of different ways, and so then you get them eating carbohydrates, and maybe a lot of just generally eating more as a way to again, if you look at the hibernating, it may be that they're kind of storehousing for a long hard spell. It could well be this kind of
it looks very similar, doesn't it?
Reversion to that earlier kind of behavior.
Well, and it looks like part of this pattern too, and maybe this is connected to the serotonin or the neurotransmitters. We've talked in other shows about, we talk about psychiatric medication, that one of the major ways that you treat depression is using antidepressants like serotonin reuptake inhibitors, Prozac, Zoloft, that sort of thing. Well, it looks like part of that has to do with the actual depression symptoms, things like despair, misery, guilt. I mean, what would the guilt be about with depression, do you suspect?
Well, I think one of the symptoms that we haven't mentioned so far is, and also the first two, is you begin feeling bad about the way you're doing, the way you're eating, sleeping. You think you're not being the person you ought to be.
Okay.
Okay, so here you are, you're sleeping a lot. What's the matter with me? There must be something wrong with me. I'm eating all this food. If eating disorders or eating issues are a part of the person's life, then they go, well, gee, I'm sliding back. I feel so bad because I thought I could keep this up. So those kinds of issues that might come up for a person. And also, as you're going through this, we haven't gotten to this one, but the family issues. If you're not treating those around you like you would like, as you would like, then that could well be another area where you feel guilty about just the way things are. The way you're treating others, yourself, as you go through.
Well, yeah, it sounds like participating, either at work or at home, would become increasingly more difficult. I mean, if you're craving sleep and you're wanting to eat, I could see where there could potentially be some feedback from people around you saying, "What's the matter with you?" or "How come you're not showing up? How come you're not being part of?" Let's take a look at some more of the symptoms to get some more clarity here. We mentioned family problems, avoiding company, irritability, loss of libido, loss of feeling, maybe lethargy, too tired to cope. Everything seems like an effort. Physical symptoms, maybe joint pain, stomach problems, lower resistance to infection, so you just seem to catch everything that comes by. And maybe even behavioral problems. And in the literature, they mention a lot that children with S.A.D will appear difficult or hard to deal with, or lazy. They won't want to do their homework. They'll want to stay in bed and that sort of thing. And sometimes parents may see that as them just being obstinate or uncooperative. And it may be that their little systems are just not functioning
the way they ought to during those seasons. And of course that would correspond with, to a large extent, the academic year.
Yes.
So Yeah, so, and of course that's part of the reason the academic year is when it is in winter when the children didn't have to be out in the fields working.
That's true. It was set up around our agricultural culture. That's right.
So, yeah, so they'd be in school and they may well not be doing as well as you think they ought to. So that might be one of the indicators too, is how they're doing academically and how they're functioning in the school setting.
So as adults, it looks like we might be avoidant of people, isolating. We don't feel very sexual. It looks like I was intrigued with joint pain and stomach problems. I mean, that was kind of interesting to me. I'm wondering if, given the lower resistance in general, you might simply feel everything that goes on in your body differently.
That's one good possibility. And I think of depression, and I think this is at least in the overarching category of depression, however you want to parcel it up, that there really is a depression. Not only we think of it as being mental and of feeling down and blue, but in depression, because we get these classic vegetative symptoms like psychomotor retardation, well, your whole body is depressed. It's a depressed functioning. And that lower level of function, almost a lower metabolism, kind of, you might think of it that way.
So it's like your whole body, your whole system is slowing down.
Slowing down. Exactly.
Huh. So you would feel the resistance of your body to movement, which is why maybe the
And it can be things like good circulation is compromised or something like that. You might get some of the aches and pains and such. Okay. That could crop up as a result of the slower functioning of the body.
And just being less active in general.
Yeah, that too.
We're going to take a quick break, and when we come back, we'll learn about where this comes from and how we might treat it. Stay tuned.
Well, it was really a drag. I really felt unmotivated. I wanted to sleep all the time, I'd kind of wake up in the morning and then just stay in bed. It didn't seem like there was much reason to get up. I knew that it wasn't a good idea to cut myself off from friends, so I would continue to do things, but it never really felt that fulfilling, It was kind of like I was putting on an act or something, and it felt like such an expenditure of energy that it wasn't worth